What I want to demonstrate today is something called high definition SmartLipo and explain how it's different than regular SmartLipo. So when I do regular SmartLipo, I get very, very nice results, and what I principally do is focus in on the triceps area, because this is the area that most women have a problem with. They have looser skin, and obviously this is where most of the fat accumulates. And what's nice about it, it's a very teeny incision, and then I can work through this area and I get very, very nice results. However, in select patients that want to take it to the next level, I'm doing what's called high definition SmartLipo. And what this requires is more incisions, but it allows me to access the entire arm. So what would I be doing differently? I would make 1 or 2 incisions and I would work on this area where you can see it in the shoulder girdle. There's a little accumulation of fat. Again, not terrible. I'd also make another incision, so I'd work traditionally like this as well. But what I try and do, and again, if she flexes against me, you can see her muscles here, but there's no break. So what I'll do is try and give her a little definition around the muscle above the biceps. And then also between the brachioradialis and the biceps, try and fill this out. And then from the anterior approach, what I'm trying to do is show greater definition with the biceps. So I'll highlight this a little bit more in here, highlight some of this and removing it. So I'm trying to give her much greater definition below the biceps, above the biceps, between the deltoid and the biceps, and then also decrease the fat along the tricep area. So again, this can all be done in the office. It does require much more time. It requires more incisions. It requires them to wear the garment longer, but it allows me to give them better definition. And this is something that I will use and do on select patients depending on the request.